Alex here to break it down to see where we stand on tort reform. Alex.
Well, Dylan, at least initially, the White House is putting the burden on the states, offering up about $25 million in federal grants to get the ideas flowing. Now, the government is on the lookout for better ways to improve doctor practices, to cut down on malpractice lawsuits, and ultimately cut down on the mistakes that lead to them. And here's Health and Human Services Secretary Kathleen Sebelius on it.
Lots of states have bits and pieces of the puzzle. There are states with screening panels. There are states that have review processes. There's some voluntary mediation efforts, and we think this is an opportunity to not only look at what has had a proven effect, lowering preventable errors, increasing patient safety, which is the #1 goal, improving communications, and lowering costs.
Now, overall, Dylan, the price tag for doctors is big. It is up to $200,000 a year for malpractice insurance for some doctors. But as Secretary Sebelius indicated, the really scary part here is the human cost, because the Institute of Medicine estimates that as many as 100,000 Americans die every year from medical mistakes.
Yeah, and again, I think everybody's pretty familiar with this conversation. No one wants to have a loved one be harmed by a medical mistake and feel like they have no recourse. Also, no one wants to feel like the easiest way to make money is by filing lawsuits as opposed to creating something of value. So it's a complicated problem. It is certainly fixable, as we've got all these sort of laboratories, if you will, that are going to open up across the country to try to do it. To help us navigate it a little bit, Dr. Nancy Snyderman joins me sitting here on set. Also joined by Robert Clifford, trial attorney who fights medical malpractice cases. And Dr. Snyderman, I'll begin with you. How do you balance and how do you evaluate the impact of tort reform? And let's assume we have an effective mechanism for tort reform, which I'm assuming we're smart enough we can figure that out if we're going to go into all these different states. I may be optimistic, but let's assume we can do that. If we had real tort reform, what would the impact on cost be, however you want to define real tort reform, and how would you then manage for the understandable anxiety that somebody would have that a loved one is harmed in some fashion because of a mistake, or something that got a drunk doctor leaves which I that's a fear.
There will always be bad cases, but a bad outcome does not necessarily mean egregious behavior on the part of the doctor.
And we understand that, but at the same time, you get both sides.
I don't think we understand it. I don't think. I think people go in and everybody always wants perfect, and sometimes bad things happen. However, there should be a penalty for bad care. But with that said,
so how do you do
malpractice prices are crazy.
Right.
My malpractice cost but it's
so how do you balance for the need? I think people accept the need for tort reform.
No, I don't. Well, if they accepted the need, Dylan, we would have it. There are states that have already figured out to do it. Okay. California, Indiana, both examples.
And how
where
do
there
they
are
do
tribunals. If you have a complaint against Dr. Radigan, you file it, and there will be a panel of people who will decide that yes, it has merit, or no, it doesn't, and it goes forward. There may be some kind of handing cash to the patient, but not a multi-million-dollar suit, such that the ones that really have merit, yes, they go on. But it can't be this, I don't like what I have, throw paint against the wall, which is what we have now.
Which is similar to the model you see in a number of industries. The sporting industry uses it, an arbitration model where you basically go outside of the jury system and say, listen, we're going to create a tribunal or an arbitration panel that will resolve these things.
Cuts down on costs, people still get their day in court, provides for better medicine.
And when the president talks about testing these things out, is that what he's talking about?
No, I think the president waffled. He knows darn well those things are out there. You just have to say, look, these are states where it works. Let's talk about a national system instead of this hodgepodge.
Councilor Clifford, walk us through your sense of interacting with an arbitration panel or a tribunal, if you will, a panel of some kind to resolve medical malpractice as opposed to the current model.
There's certainly a need for a fair review of a case before it's ever filed. For a long time, we heard the debate about frivolous lawsuits. Here in Illinois, the president's home state, we have a requirement of a certificate of merit, which means that a lawsuit cannot be filed until a competent, board-certified, qualified doctor says, I've looked at this case and there's a reasonable basis upon which to file the lawsuit. You can solve the malpractice problem like they have in California or Indiana if you want to take people's rights away. way. In the state of Indiana, you could be a guy making $1 million a year and they kill you on the operating table, and your family at best is going to get $1.25 million for the entire case, and then they're going to fight you about it. In California, they've had caps on damages, which our president has specifically said take away people's rights. They've had caps on damages for 30 years in California and never raised it. So those are not the solutions.
Right, but I think that's the fear. I just want to get Dr. Snyderman to respond to that, because again, I don't know anybody who is in favor of allowing lawyers to willy-nilly go around chasing doctors, and it makes complete sense to me that doctors, hang on one second, Mr. Clifford, it makes sense to me that doctors would be very defensive and understandably angry about the fact that the cost of running their business and so much of their time is spent diddling around with stupid legal stuff as opposed to being a doctor. At the same time, it's understandable as to why a patient would want to feel they have some measure of protection if the 1 out of 1 millionth doctor is drunk that day and chops off the wrong leg. And I'm being that's overly dramatic, but how do you manage?
I think you go to the source of where physicians need to step up to the plate. We do a very poor job policing ourselves for one simple reason. If I think you're a lousy doctor and I can prove it, and I take a move in my community to get you out, you can turn around and sue me for restraint of trade. There's no protecting me for routing out the bad guys.
So how would you fix that?
Yeah, well, I think our academic societies, the American Academy of fill in the blank, pediatrics, the surgery, you have to allow those academic societies to have some teeth. And we have to be able to stick our necks out and get the bad guys out. We all know in every community who they are.
And the hospitals also need not to be afraid to withdraw privileges, which is what Dr. Snyderman is talking about. And they shouldn't be afraid to do it in the case of a bad doctor. But the real problem that I never hear the medical community talking about, in 2005 there was a health care bill passed here in Illinois imposing a massive tort reform that is now on appeal to our Supreme Court. But immediately after that, the insurance industry in a public forum here said, we will not lower health care premiums to the doctors, their malpractice premiums, no matter what.
Mr. Clifford, I'm out of time. I think that there's a second conversation, which is, do overall medical expenses go down after tort reform or not? It may make life better for doctors. It may make a less hostile universe, but does it ultimately drive down overall costs? Maybe it does, maybe it doesn't, but we don't have time. We'll do this one next week, but we'll talk cost next week.
Look to Texas. Malpractice premiums and healthcare costs are up in Texas, and they have massive tort reform.
Again, next week is next week. Mr. Clifford, thank you very much.